Welcome to Adapted Person. Thank you for deciding to watch video. NCLEX, the key is content mastering, coming up with the strategy and practicing. Content, strategy, and practice. So I'm going to give you the content, show you the strategy, and then we practice those questions. So let's go. What do you see? A novice nurse has attended staff education program about abdominal assessment, which action the novice nurse should perform last when assessing a client abdomen. Best way to answer question, read it from the back. I'm assessing the client abdomen. Which actions I will take last? And I'm looking at the individual abdomen, right? The content, you got to come up with your content first. When you have a patient abdomen, the steps that involve, first you look. So you inspect the abdomen. After you inspect, right, you have to listen. Don't touch the abdomen until you listen. So you auscultate, right? After you do that, you don't want to go and jam on the patient abdomen. You want to percuss lightly. And after you percuss, then you palpate. This is the content. Then when you know your content, you look at the answer. The buzzword says last action. I'm going to listen, right? Before I palpate. But the best thing you will do first, you inspect. Number one, this is inspection, listening, percussing, and then palpate. So number two is your right answer. So that's number two. Palpation is the last thing you do at the end of the procedure. So pay attention to that. That's the step. So in order to give you the content for that, I went further with this question. It's the same thing, test taking strategy. I've given you 3 sentences, make it 1. Which action and action underline the novice nurse is performing when collecting data of the abdomen? This is the same thing as assessing the abdomen. So which action the novice is doing when doing the assessment? What kind of assessment? A novice nurse is collecting variable information about a client, looking for the client, the abdominal shape, scar, distension, and bruising. What action is the novice nurse performing? If you look at somebody's abdomen and you're looking for scars, you're looking for distension, you're looking for bruises, you're looking for the shape of it, what are you doing? Are you listening, auscultating? Are you palpating? Are you inspecting? Are you percussing? That's taking strategies. You got to, the question is a little bit tricky, but when you look for the buzzwords, action, what am I assessing? I'm assessing for shape, scar, distension, and bruises. I've changed the whole questions the way I can feel comfortable. You know, I'm not listening because there's nothing here that show I'm listening. I'm not touching the patient. There's no signs of me touching them. I'm inspecting the patient and I'm not percussing. So 3 is the right answer. Number 3, same strategy, right? Content, come up with the strategy and break down the question. Which action is appropriate? I have to pick an action. I have to do something. LPN is performing a tracheostomy suctioning on the client. You can answer this question without knowing the content. Once again, content, strategy, and practicing. Therefore, what is the content of suctioning somebody with the tracheostomy? You have to know that you insert the thing without not applying pressure. You pull it out while you're applying pressure. There's a certain size of suctioning that you're supposed to use and the pressure that you're supposed to use, how much suction you should apply. These are the content. The little 5 things I've said, you can use it to answer any question. Therefore, do you don a clean gloves? It's a sterile procedure. So this one is not appropriate. Do you apply suction during insertion? No, you don't apply suction during insertion. Apply suctioning pressure of 40. This is too low. Usually it's 80 to 120 or some 100. So depending on the condition, this is too low. Therefore, test taking strategy, I've broke down each question. I've eliminated 1, 2, 3. This is 1. So the size of the catheter you use to suction is between 12 to 14 French. That is the sizes. Anything bigger or less is not inappropriate. So number 4 is your right answer. Number 4, the LPN is working a client, okay, working with a Gait belt, buzzword, who begins to fall. Now the patient fall. Patient is walking, boom, boom, then all of a sudden it's about to fall. What would you do? Which action the LPN should take first? You see, I say first thing now you should do, lower the client to the floor, hold them and bring them down. LPN, extend one leg for the patient. LPN, extend the leg for client to slide on it. Extend the leg and let the client slide on it, or hold the Gait belt. What are you going to do? I'm not going to put them on the floor. I will extend my leg, but that's not the first thing I will do. I will grab the Gait belt so that I can support them. Then extend my leg so that they can fall on it and let them slide over so that there's less fall pressure or falling down. Then lower them on the floor. So the first thing you do, hold the Gait belt. Test taking strategy, right? This is the same, whether you are LPN or RN, when using a mechanical lift, there is certain content you have to know. First, you got to know how to use it. Secondly, you got to make sure the patient is supine completely, right? Third, these are the 3 things. The patient is within this weight restriction to use that. If the weight is like 500 or 700 and the mechanical lift cannot carry that, yeah, you can apply. The rest is safety. Or anything the patient is laying on it should be locked in place, right? Content. Now let's look at it. Keep the bed side rails up. If the side rails of the bed, okay, is up, the patient is not going to be able to lower that. You may end up trying to raise the bed too high. So the bed rail should come down. So this is not good. Instruct client to hold the pulleys of the lift. If the lift is here, you tell them to hold it. Their hands can get caught up. They're supposed to fold their hand over their chest to decrease their center of gravity. So this is wrong. Keep client in semi-fowler position when applying the lift. They have to be supine. Supine position is the best way. Test taking strategy. Number 4 is the right one. Check the lift weight restriction before use. Yes, the patient is 500 pounds and the lift can carry 300. We have a problem. So this is number 4. This is the right answer. And next, provide postmortem care for a client. Which action is appropriate? Select or apply. You have to know this whether you are RN or LPN. Postpartum care is very specific. The most important is protect the body, provide some dignity, and don't let the body discolorize. So blood can pool. So the best way is for you let blood go down, drain down. So raise their head up is number 1 to prevent that. If they have dentures, keep the dentures, okay? There's no need for oral care, right? You can put small pillow under their head to allow blood to drain downward. Keep their head of the bed elevated. Remove all tags. So this is a selected apply. So what are you going to do? Are you going to remove all hospital tags? No. We got to identify the client. We got to keep the head of the bed elevated so that blood can drain and prevent discoloration. You can keep a small pillow under their chin, the same purpose. Oral care is not necessary, and keep their dentures on. Therefore, 3 and 4 are your right answer. Number 7. And which prescribed medication underlying the nurse should anticipate to hold the morning of surgery. So there's a medication. One of these, I got to hold it. That's the key buzzword, right? You're breaking down the question into one sentence. The nurse provides care for a client with what? Patient has hypertension and asthma, waiting for surgery, who is NPO. So you have a patient, 1. So those are the buzzwords. What is the case is a patient who is hypertensive, has asthma, is NPO, is going to have surgery, which medication we should hold. That's all. So I know which of these medication I should hold. Look at the problem. If they can take it, give it to them. If they need it, give it to them. If it's necessary, give it to them. If it's contraindicated for surgery, then hold it. Abudro, nothing wrong with it. Respiratory status is good. Remember, respiratory, cardiac, and neuro medication, you always want to give it to them with the sips of water, even if they are NPO. That's the trick. Those are the things you have to pay. Respiratory medication, cardiac, neuro can be given with sips. Lensinipro is one of those medications you have to hold for surgery. We don't let them take it, even though it's just for hypertension, it can affect anesthesia. But metoprolol, beta blocker, they can keep it, and steroids. You can also take it. So this is endocrine. I'll add endocrine here. So endocrine, neuro, cardiac, and respiratory medication should be given. So lisinopril, it has reaction with anesthesia. So that one needs to be held. That is the content for that one. Number 8, this is also content. Selected apply. A nurse provide care for a client at risk of what? Pressure injury. Which action the nurse should include in the plan of care? Test taking strategy, pressure injury. Which of this I should use to prevent pressure injury? Best thing, don't put pressure on the bone or the body, right? Reposition client at least 1 to 2 hours. It sounds good, right? Massage all reddened area. Their skin is already red. If you massage, you break the skin. It's a bad problem. Position the client on a donut pillow. Donut pillow provide direct pressure. I told you no pressure. No extra linen to make the bed. Yes, some people think you got to if there's two, you make the bed sheet. You usually two. You don't for your hospital. Don't say, oh, let me put 4 sheets to make the bed. The more you put sheets on the bed, the more they absorb moisture, and if they have absorbed moisture, they can cause pressure injury. So use the minimal amount of sheets as much as possible. So no extra linen to make the bed is good. Provide adequate protein and hydration. This is nutrition, is good. Keep the head of the bed at 45 degrees. This is too high. You want to prevent shearing, right? And strain. So the head of the bed should be maximum 30 degrees. So 45 is too high. Pad or bony prominence is good. So what are your answer? Number 1 is good. Number 4 is good. Number 5 is good. And number 7 is good. Content for pressure injury. And this is also same thing. Once again, content, strategy, and analysis of question, which finding need immediate intervention. We got to intervene. A home health nurse perform home safety for a client who is elderly, lives alone. Lives alone, elderly, which one we should intervene? Safety problem, which one? Cough, crying for safety issue. Rubber mat in the bed, bathroom. That's good. This is not skid. 2 grab bars in the shower. This is good. Patient can hold on to it so that they don't fall. Stairs with steady hard rails. Or you can say handrails. That is also good. Extension cord running under the carpet. There should be no wire running under the carpet. It can cut fire, you can trip on it. So this is screaming for problem. So number 4 is the right answer. Last one, test taking strategy, answering questions with content. If you need more, check Adapt & Close. All the content out there. I will help you pass your LPN test. The nurse is caring for clients who need neutropenic precaution. Which intervention the nurse should intervene? Bring your content, then analyze the question, then come out with the practice to solve the question. First, break down neutropenic precaution. Means they are neutropenic. You want to prevent infection. So which of those is going to prevent infection in this patient? Place client in semi-private. No, put them in alone. private room. Semi-private room, that means there's somebody there. Put them in the private room. Restrict visitors. No, visitors can visit, but they got to stay away, shorter time, wash their hands, other thing. Institute meticulous hand hygiene. Hand hygiene is number one to prevent infection. Wear N95 for routine care. You don't need N95. This is too overkill. So the most important thing you should do is to institute an hygiene. This is Adapt NCLEX. I'll be making a bunch of this, but good luck and check Adapt NCLEX, subscribe or share this video. Once again, content, concept mastering, strategy, and practice. Adapt NCLEX, get your back. Take care of yourself. And if you want to learn content, to join our crash course that is coming up. All the best of luck and bye.